Hello and welcome to another episode of Discover with Spinati. I'm your host, Dr. Spinati. Now, the reason, by the way, that I've decreased the tone of my voice is because I realize there's a lot of reverberation with regards to this mic. And so I know that if I speak too loud, then this thing's going to pick up some reverb. And so that's why I decided that I should probably tone the voice down a little bit so that you don't get the reverb, if you know what I mean. Charlie here wants to demonstrate what it's like to get an implant too early. So let's say you're 16 years old, you knocked that tooth right out of your jaw, right out of the park, and you're considering doing a dental implant. Let's say, hypothetically speaking, you get a dental implant. Okay, so Charlie here, this is the dental implant, by the way, like this. Okay, so let's say you put this dental implant in here, correct? So you put it in here, everything's great, right? So you put it in there and you have a crown that comes out and everything's great. But then what happens is, do you see here this yellow? So when you're 16, this is still growing, right? Especially this part. So this is still growing. So if you have a tooth or an implant here and the bone is still growing, well, guess what's going to happen? The implant's not going to go down. The implant's going to be stuck where you put it. So if it's growing, if it keeps going down, for instance, guess what's going to happen? That tooth or that crown that's attached to this implant is going to be buried as well. Now you're going to have something that looks hideous, looks absolutely disgusting. It's going to be out of alignment and it's not going to look good at all. And that defeats the purpose of you actually putting an implant in. So, when should you put an implant in? Recommendations are at least when you're 20 years old, at least when you're 20 years old. Because by then, and some even say 22 years old, okay, and some even say delay it as long as possible. So let me give you an example. So let's say, for instance, you knock this tooth out. Okay, you knock this tooth out, right? It's knocked out. So you knocked it out at, let's say, I don't know, 18. Okay, you knocked out this tooth. Or let's say you were born with congenitally missing laterals. I see a lot of these patients. So they have these two teeth are missing. So what do you do? Do you wait until you're 18 or 20 and then you put implants in? Or is there an alternative? There's definitely an alternative. And the alternative is called Maryland Bridge. Okay, so a Maryland Bridge is basically a bridge that's attached to one tooth. Okay, and it lasts a very long time. It can last 10, 20 years, maybe sometimes even longer if it's done properly. And it's not invasive. There's no removal of tooth structure. It's just bonded on, and it looks really natural if it's done properly. It looks really, really nice. And it doesn't matter whether or not the procedure is done at this age or it's done later in terms of putting on an implant. The procedure is the exact same. So you're going to have to go through bone grafting and implant placement anyway. So the choice is to delay the implant as much as possible, because as much as we want the implant to last a lifetime, the implant doesn't last a lifetime because over time, obviously, and the younger you have it, the more that you're prone to these kind of effects. So over time, what I was going to say is that you actually start to lose bone. You have an increased chance of having periimplantitis, which means more loss of bone, inflammation of the gums. You start seeing those threads. You start seeing these metal threads on the actual implant here. Okay, so you start seeing these threads. Okay, you can see those threads there, and so because of that, that's why it's recommended for you to delay the implant placement as much as possible, especially when it comes to the front teeth. Now, the back teeth, completely different story, but I'm talking specifically related to the front teeth. Okay, because the front teeth, there are alternatives that will get you by really well. Okay, in the front, that will get you by if if that happens to you. Now, how old is too old when it comes to dental implants? No such thing. There are such things, though, that would help in terms of making sure that the implant succeeds, which is not having any systemic issues. So, not having uncontrolled diabetes. If you have diabetes, it's fine if it's controlled. So, if your blood sugar level is controlled and your blood and your diet's controlled, then it's fine if you have diabetes. If you're a smoker, that's a big no-no. because as we discussed before, being a smoker doesn't allow the actual implant to fight off the infections around it, okay, because of the constriction of blood flow in that area, and also because smoking is bad in all areas, okay, but smoking specifically, it's tied to having a low success rate for implants. So that's for smoking. Diabetes, any other systemic issues, autoimmune issues, decreases the chance of success. But other than that, and also obviously having very thin bone, which requires you to have more bone grafting. So all these things, as you get older, you get more and more prone to them. And so you have to kind of take that into account, and your surgeon, whoever's doing the implant, will definitely take that into account whenever you are prepared to do the dental implants. So, in terms of age, are you too young to get dental implants? I don't recommend you getting dental implants before the age, or I mean, until the age of at least 22, because I prescribe to that, or I subscribe to that. So wait until the age of 22 at least, or try to delay it as much as possible when we're talking about the front teeth specifically. Talking about the back teeth, yes, wait until you're 22, 23, because by then the jawbone would have stopped developing. And so when you put an implant in, it's not going to get buried when the bone grows. So yeah, so wait until that time. And in the meantime, you can put a spacer. If it's too much of an effect, then yes, you can work with your dentist to come up with a creative solution. If you have any questions regarding dental implants, feel free to feed us to us. We're more than happy to answer them for you along your wonderful dental journey, whether it's for cosmetics, whether it's for oral health, whether it's for both. Let us know, and we'll be more than happy to help you out. And happy Tuesday, as always. Keep smiling.